Hi, and welcome to our 53rd session. My name is Taylor, and tonight we have for you an NP Spotlight on primary care with nurse practitioner Jackie Balagbar. Next slide, please. So next week, our upcoming session is going to be on family medicine residency, and then we're going to have a specialty spotlight in internal medicine, followed by a specialty spotlight in radiology, and then a PA spotlight in dermatology. So stay tuned for those. As always, we've got our working group with Rachel, Reagan, Shayan, Ani, Alana, myself, Ollie, and then we have our physicians, Dr. Fowler, Dr. Brandon Morchetti, Dr. Salazar, and Dr. Reno. And then, so I just want you guys to give a warm welcome to nurse practitioner Jackie Balagbar.
So Jackie, before you start, let me interject just for a moment, if you don't mind. Welcome, everybody. Taylor, we'll have our usual question answer sessions, one halfway through, is that right? And the other at the end in the usual spots.
Yes.
Okay, welcome everybody. Sorry about last week. We had a schedule glitch with our presenter. We won't let that happen again. We'll have a backup talk every week, we promise. And it's really great to have you. We have now reached over 1,000 universities in 36 nations, and we've had over 250,000 hours viewed of our program. So clearly we're touching on a nerve of something that's really important to pre-health providers. And we're trying to bring you what you want to hear. We'll be examining what we've presented so far and that are all posted online to look to see that as the next year evolves, and this will be the last session of our first year of doing this tonight. So we're reaching an anniversary this evening. So congratulations to us. Put congratulations in chat if you want to, for surviving a year. And if thank you, Karina, and all the rest. And we're going to be here. If you keep coming back, we're going to be here. Our plans are to be here, and we're filling out the schedule for July. We have a tentative plan at the moment to have an actual practice interview session. And what we're going to do is we're going to extend a contest to you, the students. And we'll figure out a way to make it competitive. And we're going to, among others, we're going to have 2 of you volunteer to be interviewed. So you might decide if you want to do that live in front of about 300 of your closest friends. So anyway, it's great to be here. Sorry about last week, and we will certainly be here next week. And without further ado, let me introduce our new friend to our family, one of Dallas County's own. Jackie, please introduce yourself and welcome on behalf of the whole working shadowing team and over 200 students who are just here to hear what you have to say tonight.
Hello, good evening, everyone. My name is Jackie Balagbar. I'm a family nurse practitioner, and the name of my clinic is Subclinica Familiar, and I'm located in Garland, Texas. Actually, Garland, Texas, I was born and raised in the Philippines, but I was a dentist in the Philippines, and when we came here, the first area that I went to where my brother is in Mesquite, but it's like at the borderline of Mesquite and Garland. And I fell in love with the place in Garland where I had my first apartment, and my goal is to be able to help the people there. That's the reason why I specifically look for a clinic located in a particular area in Garland where my first job was. So, my dad is he's a doctor, and I guess that's kind of like but I'm a dentist. He's a doctor. He's a family doctor, but it's kind of like same in line with the medical practice. And with this one, well, these are my caring staff. All of them, as you notice, the name of my clinic is Subclinica Familiar. I don't speak Spanish. I'm not Spanish. I'm Filipino, but some of our languages are also from Spaniards because we've been under them under 333 years, the Philippines. So most of our words are actually have Spanish. And these are my staff, and all of them speak Spanish. And when I started my practice, it's actually only me and the lady behind with the tallest. It's only me and her for months. She's the front desk. She's my MA. I'm a front desk. I'm an MA. I'm a practitioner. And in 8 months, I was able to hire another one. And as you can see, we had grown. And even with the clinic, this is the clinic I'm right now. I have 6 exam rooms, and it has grown. Across the street of this building is where I started my practice. But it's behind. I'm like at the back of the building. You cannot see the clinic except for the name. And when I had the opportunity to be able to move across the street, thanks to my landlord, because I found black mold in my clinic. And I told him it's not, and that's the only reason why I was able to get off the lease. But good thing this place is it's outside. I mean, in front of this parking that you see is a busy street. It's in Shiloh. So for those who are familiar with the Garland area, my office is situated at the Walnut and Shiloh area. It's a busy area and a lot of Hispanic. And this is one of the reasons I named my clinic Su Clinica Familiar. Has something to do with marketing. Okay. When you open a practice, you want to make sure that you'll be able to reach out to the community. So once they, and the meaning of Su Clinica Familiar is your family clinic. I didn't pick Mi Clinica Familiar because it's theirs. It's I want them to feel that this is your clinic. You know, I'm just here to serve you, and 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 that's what I want to do. I want to give back to the community. And preparing today for tomorrow's workplace. I actually give this talk in a high school. So I don't know if there's some, I'm sure there's some high schooler right here and you don't know exactly what you want to be when you grow up or what you want to be. Normally what we do is when we were a kid, we already kind of wanting what we want to be based on our parents' job, our or our uncles, our friends, and it can be a doctor, or sometimes your parents already know what you want to be. Your parents, they want you to be a doctor, they want you to be a lawyer, they want you to be. It depends on the culture. But most of the time, like in the Philippines, most of the parents, they want their kids to be a doctor or a lawyer, but never a nurse, never. My dad is a doctor, and for him, which I don't understand it. I can Now I understand what he was talking about, but he doesn't want any of us to be a nurse. And I goes, why? I said, well, because nurses just like in the uniform and they just be the one that help the patient. And I'm like, so, and I'm just like, for years, it kind of bothers me about that because I became a nurse and then I was talking to him about it. And actually the nurses are the one that actually doing and taking care of these patients. I mean, even in the hospital, there's the first people that the patient that talks to. They're the one that's always there with the patient. Sorry, Dr. Fowler, Dr. Salazar, but
No, Jackie, it's true.
nurses.
I've been hospital based for over 45 years, and it's always been that way. Is that the nurses practice most of the medicine that we do. We order a shot, they give it. We order serial vitals, they do it.
Yes.
And they fill out the medications, allergies, a lot of the patient's history. So number one, the nurses are so critical to the infrastructure of medicine. And number two, we have to work, therefore, as a team, and the team approach is critical.
Yeah. And the reason why I put for tomorrow's workplace, it's because it doesn't matter what you pick from. When you go to work, it doesn't have to be an 8 to 5 job, because if you think of it as an 8 to 5 job, guess what? You're not going to be happy. For you, it's just like an income. I need an income. I need this to pay my rent this month. I need this. And so you have to think of something. You have to have a passion of what you want. And that leads me to the next slide. Remember, you can be whoever you choose to be. Okay. I remember growing up, my dad told me, I know you guys are taking a test. So if I put a ting ting, this probably will come out on your test. But anyway, I'm giving you a hint. Remember, you can be whoever you choose to be. I remember growing up, my dad told me that education is like a ladder. You have to take this one step at a time. You cannot just jump on top, or you will fail, or you will miss something and you will not succeed. That I have, and he also told me that I have to pick a career, a degree that it will still be around when I finish. So I joked with him and I said, well, Dad, I want to be a dentist. So do you think the teeth will not be around by the time I'm done with my career? And he's just like, well, unless they stop having babies. And then my dad is like, it doesn't matter what you choose, but make sure you choose and finish it. It will be hard. There is nothing easy in life, but never quit. Okay. And it's like whatever you decide, you finish it. It's not gonna be easy all the time, but never quit. Or that will become a habit of yours. And that will become that's something that every time there's something in our life that becomes hard, we just leave. We just quit and jump to another one. So I apply that in everything I do. So for you to succeed, you have to love what you do. And just remember, even though it's hard, you know that sometimes you will see the light at the end of the tunnel. And it feels so good. I mean, just like Rachel, you work so hard, you apply for medical school, like what you said, you cry all day. And that's the feeling. That's the feeling that you want when you go to work also. I You can see from 5 patients to 30 patients every day. But if you don't have that passion, you will never be happy. Like I said, it's not, I mean, money is good, okay? But it's not all about money. Before I came to America, I was a practicing dentist in the Philippines. I have a good job. But my family decided that we need to migrate to the States. Because for in the Philippines, once you say United States or America, it is the land of honey, meaning rich. It's milk and honey. It's kind of like, I mean, once you use the term, it's like it's very rich. It's people there, they earn dollars. And when I got here, yeah, they have to earn dollars, but you have to work. I mean, I thought when I come here, I will just be given the dollar. But no. And you know, my experience when I first got here, and I'm a dentist from the Philippines, and I'm applying for as a dental assistant. The first question was, do you have a local experience? I don't know what it means. A local experience. I mean, it's like, have you have a job before? And I said, no. I was like, well, we cannot because you have to have experience for her to hire you. And it's like, well, how will I get an experience if you don't give me a chance? And so at least my dad's friend, who's also a doctor that had a son that's a dentist, was able to give me my first job. That's in Garland. And that's what I was telling you about. That's why I picked Garland, because that's where my first job as a dental assistant. And I got the experience, was able to move on to a different practice. But my point here is it doesn't matter what you choose. You have to have a passion, to have joy. In any job that you have, you make sure that you balance your work and family and self. I mean, we need a break also. Like, even just for 5-10 minutes away from your work, away from your family, just you can sing, do whatever you want to do. Or at work, and this I always tell my staff, when you're here at the office, you have to give 100% of yourself at work, or else you will miss something, and it's not fair to our patients. And when you're at home, I don't expect you to do your job at home, because I want you to give 100% of yourself to your family. You can vent. And in here in the house is we do this. Once I get home and I started talking, we do this. It means 5 minutes. You have 5 minutes to vent. You have 5 minutes to talk about your work. After that, it's our time. And because sometimes people, they get home, they still stay in their computer, right? And they still do the work. Your kids are talking to you and you're still talking you're still working and doing all that. So that's why it's very important to choose the career where what you love. It's not because your parents told you to take this, or your friends, or you're following your friends or your boyfriend or your girlfriend, but you need to have that passion of what you want. Okay. um I'm sorry. These are the different career through my lifetime that I was a dentist in the Philippines, and I came here, and for me to be a dentist I had to go back to school. So I settled to being a dental assistant. But even in the Philippines, it's always been a dream of mine to have my own business, to have my own clinic actually as a dentist, and not just working with somebody, because you can do more, you can help more people if you don't have to ask somebody what you can do or what you can give for someone, right? And then I became a realtor. When I was working as a realtor, I was working in another company. When somebody is trying to sell and buy a property, you can give them a break on your commission. But if you're working with somebody, you can't do that. It's always what matters with the corporate world. And so I decided to become a broker, because if I'm a broker, I don't have to check with anybody but for myself. And so being broker, I have some agents under me, and it's been doing well until the 9/11 hits, and everybody just shut down. Everybody just went down. And I decided to go back to school and to be a nurse. I was thinking like, well, medical, it's always be around. So I decided to be a registered nurse, and I was working as a dialysis nurse. Actually, I worked with Practitioner and I work at the Vita. And with that, I mean, it's doing well and everything. But there are things that sometimes as a nurse, you have a patient, you want to help them right away, but you cannot, what you can do for them. But of course, you cannot do it for them because you have to wait for the doctor's order. And even though you talk with the doctor, sometimes it takes time for them to get back to you. And so I decided I had the opportunity to be able to go back to school once again and become a nurse practitioner. So if you look at all these careers, from being a dentist, as a realtor, as a broker, and registered nurse, took me about 16, 20 years to be a dentist in the Philippines is 6 years. Going back to a realtor is about a year, two. A broker is another two. Registered nurse is another 4 years. And then being a nurse practitioner, going through that. So it's about, I'd say about 16 years to get to where I am right now. But as you can see, with all my careers, it involves people. I always like to deal with people, helping people of what I can do. So way back, this slide right here is just a brief history of where the nurse practitioners started, or when the medicine or the medical healthcare system started. It started in the 3000 BC. I will not read this to you, but the most important here is in the early 60s, when the term nurse practitioner being used to describe the many nurses serving in the primary care roles in response to the national shortage of the healthcare services. And then in 1971, that is when the U.S. Secretary of Health, Education, and Welfare makes it formal recommendation for stating the nurse practitioner are qualified and considered as a primary care provider. And the difference between the nurse practitioner, like the friends, I'll be there for you. That's who we are. Nurses means nursing, caring. Now we are just nurse in practice. That's why they kept that word nurse practitioner, because it stays with us. Whatever we did as a nurse, it will not change. It will not go up to our head that, oh wow, we are the nurse practitioner now, we can, we can do this, we can do that. No, the care is still the same. It's still there. It will never go away, and I hope that that's what it is also for the other that are wanting to be a nurse practitioner or already a nurse practitioner that's listening right now. I mean, and I know you are always there for your patients. The difference between the nurse, yeah, what is the, I'm sorry, what is the difference between the nurse and the nurse practitioner? In education and training, there's also another, which is the LPN. They are actually, the LPN is under the registered nurse. And then, but the registered nurse and the nurse practitioner, they're not under the nurse practitioner. They can move up to become a nurse practitioner, but they will require a master's degree on that one. And this is the highest nursing position, performing as much as the same function as a doctor. We are not doctor, but patient, because we are wearing a white robe coat, they will always call us a doctor. So many times I've already tell patient, call me Jackie, just plain Jackie, and they still call me doctor. And as long as I don't say I am a doctor, then no. But if I want to be a doctor, then I have to go back to school again for doctor of nursing, which is the DNP. That's another degree. That's another step. That's a step up from being a nurse practitioner. But and this one right here, it says the nurse is temporarily have the consciousness of the unconscious, the love of life of the suicidal, and the leg of the amputee, the eye of the newly blind, a mean of locomotion for the newborn, knowledge and confidence for the young mother, a voice for those too weak to speak, and so on. And this is by Virginia Henderson, nurse practitioner. Being a nurse and nurse practitioner for me is the same when it comes, like what I mentioned earlier, about caring for our patient. We give it all. The word nurse came from the word nursing or caring. That's why they keep the word of nurse practitioner on the nurse practitioner, because we are just practicing. And the difference of us being with the doctor is there's still a lot. We are limited with the scope that we have, and we cannot never ever replace a doctor. I mean, they went to school much longer, they have more knowledge, but we are here to help them to reach out more people. And that's what's happening right now. There are some shortage of doctors right now that, nurse practitioners are stepping up to help on some primary clinic. We go above and beyond of what we can do for our patients. But remember to stick to your scope of practice, because if you do more than that and you're not allowed, then you're actually not doing it for your patient.
Jackie, that word temporarily in that first line there, I couldn't help but think there's also temporally, and in a way, temporarily means for a short period or for a period of time. Temporally means for the time or part of the time, and it means that if you were to use the word temporally rather than temporarily, temporally the nurse becomes for the time the consciousness of the unconscious and so forth. And so the nurse is the advocate for the patient in in medicine. And we as physicians do the same thing, and as practitioners. But I think that's a terrific quote.
Yeah, and actually, this one I picked, especially when we had this pandemic. I mean, we still have, but it just makes me sad, especially those people that was affected by this COVID. No, they don't have family members. They died at the hospital on their own. But actually, no, they did not die by themselves. They did not die alone because the nurses are with them. The nurses are the one that held their hands. The nurses are the one that reminded them that their family is just on the phone or outside the hospital and praying for them. And that's why I like this one, is because it's true, especially now. I think the nurses have experienced this more with this pandemic time. That's why I kind of, when I was looking for a quote, I mean, this is one of the one that I had picked, and it just speak to everyone, you know. Nurse practitioner, we have brain of a doctor but heart of a nurse. And I was born to be a nurse practitioner, to hold, to aid, to save, to help, to teach, to inspire. It's who I am. My calling, my passion, again, passion. It will always be on my talk. It's the passion that you had to have, my life and my world. We focus on a patient-centered approach and see the person as a whole and work to address everything, not just the ailment, issue, or health concern. The only thing that's difficult for me, being in a Hispanic community, is when my patients start talking to me, like they're very emotional and start talking to me in very fast Spanish language. I have to put a pause on them, and I have to get my assistant to translate it. I can understand when you speak slower, but of course, when they're sharing their emotion, and I think that's the only thing that's bad, that I have to have somebody interpret to me. So, like the flow of they're crying, and then I have to like stop, and I have to get somebody for me to be able to assist them, for me to be able to help them. I wish I can, a little bit. I mean, it's getting better for me understanding them, but I wish I could just respond to them, I mean, sooner, earlier. um that's why I mean, and when my patient come to my clinic, though, they will not feel that I am rushing on them. I let them feel that they're the patient right there at that moment if they need to talk to me. And you have to focus on your patient. Don't just focus on, oh, okay, you're coughing. And I've heard it, and some of my patients will tell me, yeah, they just prescribed me medicine. They didn't even listen to my lungs. They didn't even check me. They just like, well, oh, you're coughing, here's your medication. And I want to change that. I don't want it to be a quick one. I mean, if I do a we'll talk about that on the future slide. There's some that I will be talking about that. But there you go, the 5-minute consult. There is a new book that says 5 minutes consult. Yes, it's for us. That 5-minute consult is for us. When somebody comes in with this problem, it's a book that we go to and said, okay, this patient has this. Okay, what are the treatment? It's for the provider. It is not for the patient. We have the thing with this, the 5-minute consult is, when I change my job, when I was working with the 2 clinics that I have, one of the doctor told me, you can do a 5-minute consult. You can do a 5-minute physical. And I'm like, no, I cannot. I'm sorry. Okay. I said, I cannot do a 5-minute physical exam. If you think that I can, then we'll go ahead and just do it on your own kids and see how you feel about it. 5 minutes is up, then I'll stop. You cannot put a time with your patient. While they're still talking to you, you have to sit down and listen to them. You have to give your moment. They come in there and expecting to be treated and expecting to be taken seriously. But if you cannot do that, then you are on a wrong practice. You are on the wrong career. And so that's another thing that I have when I was with the other clinic, is they're rushing us. It's like, come on, come on. You need to see more patient. The more patient, the more money. And I'm not saying money is not good. Money is good, of course. Who doesn't want money? And why would I open my clinic just for me to give away things? No, but you have to weigh things too. I give some free services to my patient of what I have. I mean, whatever I can do for them. If they come and say, oh, I cannot pay for this one, but I can pay for this one. And I'll just, like, urine tests. If I tell them, if my staff tells me that, Jackie, they don't want to do the urine test and I need it because I want to know if she has an infection or what's going on, I will just tell my staff, "Just go ahead and do it. Don't charge them." Those are, I mean, those are I'm not saying I'll give away uh, a free visit for physical and complete and blood work. But I have done that when I was starting my practice, actually. When you're starting your practice and you don't have any patients, you only see one or two patients, you will see a patient and we'll do some free stuff for them. So the reason why this is one of the reasons I decided to open up my own practice. And I will talk to you more about that on the next slide. But having somebody that you work with that doesn't have the same values, the same morals that you have, it's hard. It's not going to work because you will question yourself also. Even though you get paid, you get paid a lot more money working with somebody, it's not worth it if you're not be able to keep that value on your morals that your parents have raised you, to and to apply to yourself. This one, this one, let's see right here. The practice of mindfulness is monitoring your mind all day and all night. It's enjoyable to just remove things that make you unhappy from your mind to clarify your emotion. Again, this quote right here just answer my question that I just spoke earlier about the 5 minutes consult. Do you think if I do a 5 minutes physical, a 5 minutes checkup on my patient because I was so rushed, do you think I'll be able to sleep at night and think, did I do a good job with that patient? Did I did the right diagnosis? Did I give that patient the right medication? Or I was so in a hurry that I don't know. If you'll be able to sleep at night doing that, then I don't know what to tell you. But for me, you always have to have practice of mindfulness in monitoring, so you'll be able to have that peace and that joy in your mind. And once you're happy, your family is happy with you.
Jackie, if you can go back to that slide, I completely agree with you. And there is so much in the world right now, smartphones, social media, that clutter our mind and distract us. And I have been very, if you will, mindful of that in my own life. This is why I have one of these and not a smartphone, which people laugh at. But you know what? You can be on the computer all day and you can find yourself distracted and being outside of your own mind all day long.
Yeah.
And by the way, Clayton, Clayton just said he loved those phones. Clayton, you can still buy a flip phone. They still make them. But mindfulness becomes a choice, if you know what I mean. And when you use mindfulness, I share with you, I don't mean to interrupt your talk, but just one more comment.
No, it's okay.
I think in my 44 years of clinical practice, I mean, that's a long time, and that's tens of thousands of hours in the ER. The number of times I've gone home at night and wrestled with, did I make the right decision Was I wrong about something? And it's led me to the point now, pushing 70 years old and working in an academic institution, where I know that my job and your job, Jackie, is not to be wrong. You can't be wrong. You've got to be right. And so I have a pause moment, a moment to pause with every single chart, undistracted, without the phones ringing. And I look over everything one more time, and it is a total mindfulness dedicated to looking at that chart and that patient one more time. So I won't be wrong. That's just the way I do it. And that's after all these years. That's the only way I know to be safe.
Actually, I base that on my experience because, like what we said, we are only humans, right? And it's actually a long weekend. Well, we're approaching the long weekend, the Memorial Weekend. And I believe it's the same weekend when it happened to me that we are getting ready to go out of town. And my last patient, I know he's wheezing, and he's a special child. He cannot tell you exactly if he's hurting or something was wrong with him. And I'm not sure if I was rushing or because I need to get out. I need to get out. We have to leave. I have to travel. But that weekend, I've been calling my assistant. I said, can you check on this patient? And I've been bothering them. I'm calling. And guess what? The phone number that they have is not a working number. It's me. It bothers me. I'm just like, oh my God, I cannot sleep. I'm just like, oh my God, I hope the mom, if something, will just take this child to an emergency, if he's not breathing right, things like that. And then there's another clinic also where they go and I called that clinic and I asked the clinic, I know we have a mutual patient. Do you have a different number for them? I tried to reach out. I cannot even enjoy. Again, 100% of my time should be with my family now because it's Memorial Weekend. It's a holiday. But no, but see, that's the thing. If you don't do the right thing, it will eat you up if you have a good conscience. But there are some people that couldn't care less. And we don't want you to be that person. We want you to, like what Dr. Fowler has said, check and overcheck. Do that. So with this one, and this one, in every practice and workplace, there's always a challenge, okay? Processing the knowledge, the value, the ethics, the skills. For you to have a good practice, all this will be perfect, right? But there's no perfect place. There's no perfect practice. And in every practice and workplace, there's always a challenge. It can be from your staff, it can be from the schedule, it can be from the supplies, equipment, or personal issues. Again, we're just human. I always tell my staff when I come to work and I see that you can tell if somebody's having a bad day or if somebody woke up on the wrong side of the bed. I will pull them aside and I say, what's going on? And they said, well, this and this and this and that. I said, okay, if you don't feel that you are here 100% right now, I need for you to step outside, take a deep breath, inhale, or walk around the building. I don't care what you do, but don't be here and do not see a patient because you will give them an attitude the minute you welcome them from the door. And this is another thing about practices, okay? And I told this to one of my colleagues. For those people that own their practice, your staff, your front desk most especially, is your face, okay? That's why I attended a seminar where they have to put a mirror by the phone, that when you answer that phone, you have to look at the mirror and remember to just like smile because people on the other end will know what kind of day you're having. But if you remind yourself, smile, look at that mirror, smile. Well, I don't have a mirror in my staff, but I will keep telling them, you have to answer the phone like lively. If you answer the phone, "Su Clinica Familiar, may I help you?" You're already dragging down. There's already an issue the way you do that. So when you notice something, you cannot just ignore. And that's one thing I have learned. You have to be open to them. And the way I talk to my staff, I'm telling them I am not mad, but you have to understand these people are also the people that will build us up and these people that will bring us down. If they bad mouth you, oh, that stuff, oh yeah, I don't like that. Actually, my daughter kind of told me about it on our Facebook. She says, Mom, I look at your Facebook. The patient loves you. I'm like, oh, great, thanks. And then she goes, but they don't like your stuff. And I'm like, what do you mean? And I don't look at those comments. And now after she told me that, now I start looking at them, like on the Google and all that. And so I talked to my staff about it. I mean, nothing personal. I don't know who it is. I don't know. I don't point fingers. When I'm talking to my staff, it's for everyone. Okay. For you to have a good practice, we have to have that value. We have to have the skills. We have to have the knowledge. And you guys have that. That's why you're here. That's why I hire you, because of all that. And so talking to them about it, but if you just let go and they don't know, they can't read minds. So you need to speak up. As a boss, you need to speak up what's on your mind, but don't underestimate them. You just talk to them.
Jackie,
Yes.
I'm sitting in my hometown in Georgia,
Uh-huh.
west of the great city of Atlanta right now, where I built an urgent care practice for 20 years. And I hired everybody that worked for me, and I trained most of them.
Mhm.
And it is the leader of the company who sets the mood.
Yes.
The patients give a lot of feedback about the doctor that saw them, and the staff sees that. And if the patients really feel that the doctor cared for them and the nursing staff, and then the staff hears that, and that the patients keep coming back because they know they're cared about, that
Mhm.
also builds the rapport within the practice. But the leader of the practice really sets the mood.
Yes. So yes, but I mean, like I said, it's a team. It's a team. It's a in every practices, wherever you work, you have to have that the team. And okay. So these are the services that we offered in our clinic. I do the school and sports physical exam, wellness exam. Normally, some people will come for their work, and I do that also. We do immunization. In Texas, the immunization is provided to us by the government. So actually, the people get their immunization for free. If they don't have an insurance, it's still free. They just have to pay us for the administration fee, which is like $14. It's really nothing. Or if they really don't have any money, you just give it to them for free because they need them. And I do simple procedure like laceration repair, which you guys going to be seeing some of that. And that's why I chose to be a family practice, because I like the combinations of everything. I'd be able to see kids, I'd be able to see adults, be able to see from minor coughing to some suturing or some other things that needed to be done. And also I do manage and help patient manage diabetes, high blood pressure, cholesterol, and others. um and we do STD and drug testing also. So we are a family practice. In our family practice, like I said, I do the management for blood pressure, high cholesterol, diabetes, most especially. But sometimes people, and this is what I have noticed, if you don't take the time to educate your patient or talk to your patient, it's not, you're not helping them. Because people will just tell me, oh, I just go to my doctor and they just prescribe it to me. Or I will call the office and they will just call me refills. Why do I have to come here and meet with you with my lab results? Why can't you not just give it to me? Because anything with the lab result that I do is I tell them, get the patient back. I don't charge for my patient to come back in for me to discuss lab results. Um, and the reason why I do this is because I want to educate them. If they have a high cholesterol, I need to be able to talk to them and tell them, okay, have you been diagnosed with this? If they said, no, this is the first time I'm hearing this, I was like, okay. And then I look at the numbers. If the numbers is not as bad, where, a little bit elevated here, a little bit elevated there, but if you don't talk to them about it, they will not know what's wrong with them. So I will tell them, okay, I will give you 3 months. We're going to do a lifestyle modification, a lifestyle change. This is what you're going to do. You're going to do proper diet, specifically cut down on this, cut down on that. You need to. The pills is good, but it's a temporary solution, and not only that, there's a different side effect. That's why so many patients out there have this pill box with 18 medicine, 16 medicine. Why? The doctor will give you a medication for your cholesterol, and then suddenly you will feel, you know what? Ever since I started this medication, I start to feel dizzy. I don't know what's going on. Oh, dizziness. Okay, here's a medication for dizziness. Or headache. Oh, headache. Oh, the best example to this is my favorite. A patient will come to me and say, I have a headache and I feel dizzy. I'm like, okay, well, what have you been doing? What's going on? And I was like, I don't know. I mean, it's just this season change and all that. Texas is number one in allergies. Okay. So I check them, I look at them, and I said, you feel dizzy? He said, yes. Do you feel like a pressure? The headache, is it like a pressure headache on your head? And this, and I'll check them. So I check them, everything. It's like when I press here and I press there. And I check their nostrils. They check the inside of the nose. I mean, the patient has sinus infection. And they've been telling us like, well, you're like the third clinic that I've been to. And, I'm just like, so what happened? Oh, they gave me something for dizziness. They gave me something for headache. They just told me to take some Tylenol, some Motrin. Like, okay. So I checked them. They have allergic rhinitis, the allergies. They have sinus infection because that's where it's going to lead. The allergy doesn't get treated, nasal congestion, then they will have all this mucus that build up, becomes a sinus infection. So I'll tell them, this is what you have. So I treat them. And now I tell them, and this is the purpose of this, is to tell you guys that when a patient comes to you with a headache, the headache just doesn't come because you have a headache. You have to find a reason, the cause, why they are having a headache, why they're feeling dizzy, why they're feeling this. You have to find the cause of it, and you have to treat the cause. You just don't treat the problem. Because if I just keep giving them Motrin, eventually they'll come back to me and said, I have an abdominal pain now. Okay, now what happened? Because of the Motrin that you keep giving the patient. Now this patient is probably have ulcer from all this Motrin that they're taking. Or give them Tylenol. Now you're damaging their liver. I mean, you have to expand. You have to educate them. I have patients that will come to me with a child, and the mom will just say, I said, what medication are you? What medication is the child taking? Oh, I'm giving him Motrin. I goes, why? Because she's coughing. She's coughing, and you give her Motrin. I said, it doesn't make sense. But the mom doesn't know. She doesn't understand. Oh, I said, well, Motrin is for pain and fever. Oh, well, she has a fever too. What's her temperature? I don't know. I just touch her. She's hot. I mean, my mouth is just always just like, ha. So we have to take time to educate our patient. Please, that's one thing I mean, if anything that you will get from this lecture or from this teaching, please take your time and educate your patient anywhere, any practices that you do, listen to them. And this is one of the reason why I choose a family practice, is because I was with a pediatrician, so we can only treat pediatrics, of course. With my two jobs, that's what it is. It's focused on pediatrics, and the parents will come and will say, uh, they will just be on the table and laying down. I said, "What's wrong?" And then she's like, "I don't feel good. I feel sick." And I goes, "Well, then you need to be seen if you're sick." "Well, I don't have money. I don't have insurance. And my daughter is sick now, but they have insurance." I said, "Okay." And then one mom asked me, "Can I take my daughter's antibiotic?" I'm just like, "No. Why? Why?" "Well, because I'm sick and I think I have an infection." First of all, your daughter is sick and she needs antibiotic. Second, her medication is just like candy to you. It will not even do you any good. So please don't no, you know. And that's why I open my practice as a family practice. I see both adults and kids. And in my practice, like I told you, I want to reach out and help the community. I have a special for $99, and that includes a complete physical from head to toe. And when I tell you complete physical from head to toe, the way I do my physical at my clinic is, doesn't matter if it's a kid, even with the kids. I mean, we have especially with Medicaid, you have to check the kids on cloth to be able to do that. You know, you give them a gown and you check them. Why do we I mean, for me, the reason for that is some of these kids are physically abused. You know, sometimes they have burns, sometimes they have bruises. And when you check them physically, you check them physically. You check every part of their body. Okay. And so if I can do that with the kids, I do that with the adults, of course. I mean, with permission and all that. And they're just like, nobody had checked me this way. And sometimes I will feel, I mean, sometimes I'm talking to, and I got this from my the doctor that I did my clinical. And he told me, the minute that you walk in the door and you're talking to the patient and you're interviewing the patient, your eyes is already going down from head to their feet. You're already scanning them, you know. And I've done that to one of my patients. Actually, it's not my patient. She's with my patient that I'm seeing. And I was just looking and I told her, "Do you have thyroid problem?" And she's like, "What?" And goes, "I was just wondering, do you have a thyroid problem? Because you have a bump on your neck." And he goes, and then my assistant that was with me goes, "Now you made her scared. Now she's scared because you told her she has a lump on her neck." And I'm just like wondering. And that patient set up an appointment. I saw her and we did a physical on her. I did her lab work. I referred her to see an endocrinologist because of the lump on her neck. That after the x-ray, this patient have thyroid cancer. And every time she comes to my clinic now and I see that scar, and I forgot, I mean, actually, I kind of forgotten about it. And she's the one that told me, "You did this. You did this. I have my scar because you did this." And then she goes, "Thank you." So because nobody had mentioned to me about that, and I'm not even your patient, and you're just looking and you mentioned it. It feels good, right? So when you check a patient, take the time of checking them. You know, not just doing your stethoscope, doing the otoscope and all that. You really feel the lump, feel the lymph nodes, feel the head, especially with the kids. Um, I have patients that I have checked on the head, especially on the babies, and they're like, when you put your, because they have some thick hair, but if you rub your hands around their head, sometimes you'll feel it drop, like it's flat at the back. It's a flagiocephaly. And you have to, you can say, oh, maybe it's just the shape of their head. No, refer them to a specialist with a craniofacial. Just refer them and say, you know what, this is just a concern right here. Just tell the mom, because some parents, they just let their kid, and that's what's the cause of it, is these kids are just laying on, the babies are just laying on the bed all day long. Sometimes they leave them with the babysitter. The babysitter have other kids, they cannot carry them. So these are the things that the parents doesn't know, that you have to educate them and let them know. They will appreciate that. Now, so back on this, with the lifestyle change, it's same thing with what I have said. Just take the time to educate your patient. And we're going to go to that next slide. Viagra falls. I have patient that will come to me and will ask me for prescription for Viagra. Well, my doctor, give me this and I run out. Can you give this to me? But they cannot just come to you and get a prescription of this Viagra and Cialis, okay, for erectile dysfunction. Again, take the time to take their history. You ask them, why do you want this? I mean, of course, for obvious reason, they have erectile dysfunction. How long have you been having this? What changed? When did you start using this? Because what's going on with their life, with their health, if they're stressed, if they're anxious, it can affect their performance, right? And then if they're diabetic, of course, definitely it will affect their performance, because it's the blood that flows into our body that will, the regular blood flow. I'm talking to you like I'm talking to a 6-year-old here, because this is the way I talk to my patient and this is the way I educate my patient. I tell them, if you're just a normal person with no diabetic, your blood flow should be like water. That's how the blood flows in our body. It's, it just flows smoothly. But if you are diabetic, it's like a little thinner than syrup. But that's how the blood flows. And if your blood flows like that and you're having erectile dysfunction, guess what? Because your blood is not completely going to where it's supposed to be for you to have that. So, and sometimes you ask the patient, are you on any medication? Yes, I'm on medication for high blood pressure. Ah, bingo. What are you taking? Lisinopril. Ah, bingo. Do you know that the lisinopril can cause for you to have erectile dysfunction? Because it can cause for you not to have that. To have that problem. Oh, I didn't know that. Or maybe they have that is because their testosterone is so low.
Hey, Jackie, let me stop you for a second.
Yes.
The chat is blowing up, as you can imagine. We've got dozens of questions for you. And,
okay.
We get all the time, why do I need these chemistry courses and all this? And just listening to you for the last few minutes about how involved your practice is with pharmacology and the effect on humans, and the fact that you've had to learn so many side effects, for example, to be able to do what you do in family medicine.
Yeah. We have to, right? Because it's not us. For us, we're there. And the reason why the patient comes to you is because they trust you. They believe in you. They want your help. But if you cannot help them, because I have a patient that actually I saw him last week. And the first thing he comes to me is goes, I need Viagra. With my wife, I'm having this problem. And I check this patient. And my God, his A1C is 13, and he doesn't know. And when you're a diabetic, it can affect your vision. It can affect everything. It can affect your heart. You guys hear that on the commercial.
Jackie, let's put that in perspective. Folks,
Yes.
the normal blood sugar should be around 80,
Okay.
no higher than about 110. This is milligrams per deciliter fasting. And it should never be higher than 180 plus 10 per decade above the age of 40. And it should never be higher than about 200. The hemoglobin A1C, this is just for our group, Jackie. The hemoglobin A1C means, what does your average blood sugar run? And it should be under about 6% of your hemoglobin being what's called glycosylated. And that gives an average blood sugar of around 130, 140, 150, something like that. What Jackie just said with a hemoglobin A1C level of 13 is this patient's average blood sugar is 350. That's terrible. This patient is going to go blind, have a heart attack, go into renal failure, and have strokes. And what Jackie is talking about is that part of it's medication, but it's absolutely all about lifestyle.
Yeah. So when I saw him and I told him, I started him on medication, and I told him, I'm honest. And that's one thing that I don't do, is tell my patient because what they want to hear. No, they're not there to pay me to tell them, to baby them. I don't baby my patient. I'm honest with my patient. And I tell him that, and I tell this to my patient, if you're here and you're not going to listen to what I am telling you, after 3 months when you get back and it's still the same, nothing had improved, then you don't need to see me anymore. You can go somewhere else, because I don't have time to talk to somebody that doesn't listen. And having a diabetes, and I tell that to them over and over, is a serious condition. Like what Dr. Fowler said, from 6 to 13. Imagine that. And the funny thing about this patient is I gave him the medication, I educate him. And then so I told him, okay, now let's talk about, you wanted the Viagra. And she's just like, no. I don't want to hear anything about that right now. Let me just focus on this diabetes now. Because I didn't even realize how bad it is, how bad my condition is. And aside from diabetes that he has, his triglyceride is high also. And then his blood pressure is going up. With all that, being a dialysis nurse, the number one cause of renal failure is a combination of hypertension and diabetes together. The second reason of renal failure on its own is hypertension. The third is just a single one, is the diabetes. So just imagine having both of them in your body, a high cholesterol, high triglyceride, diabetes, high blood pressure. Oh my God, your kidney is going to give up on you. And that's what it is.
And, to put that in perspective, Jackie, I mean, renal failure doesn't mean much, but for people who have advanced renal failure to survive, they have to be hooked up to a machine 4 to 8 hours, 3 days a week, Monday, Wednesday, Friday, Tuesday, Thursday, Saturday.
Yes.
Their health becomes absolutely brittle. They get all sorts of metabolic problems and electrolyte problems, and they often feel terrible. Yeah. I read once that the highest cause of death in the first 5 years of being on dialysis is suicide, because it's a miserable existence. And so you take several steps back, and what Jackie is saying is that it starts with that top of the scalp to the bottom of the toenails look at the patient in a gown, not fully dressed, and really getting into the exam so that you can help the patient move to a higher state of wellness. And that is the purpose of a practitioner. Sorry, Jackie, I sound like I'm on a pulpit here, but.
No. I mean, it's like I said, because it's very important to emphasize that. And thank you for emphasizing it again. And this is why is it important to give a thorough physical examination, and a physical and well examination. And because especially with the kids, in my practice, I mean, I see kids, and the parents comes there. I mean, they bring their kids to you. I mean, aside from you're under insurance, of course, they hear you also. That's the thing about it, is when you see a patient, it's like, well, how did you hear about their clinic? And they will tell you, oh, my friend comes here, so I'm taking my kids here now. It's a good feeling, like that they're coming back to you. They heard about you from their other family members or from their friends. And the reason why it's important to give a thorough physical examination is because of this. Okay, some of this the scoliosis. I will see patients that are already teenagers or maybe young adult. And like I told you, I check them. If you check them Just with the shirt, you cannot see that unless it's like probably towards at the, maybe right here or right here where you can see it really, obvious. But when you take their shirt off and then they bend and you see them, you have to, I'm sorry, you have to address that problem, especially with the kids. Do an x-ray to see how severe it is. Ask the patient, are you having some back pain? And if they said, oh yeah, I'm having some back pain, especially, or some parents will even complain, my kids is always hunchback like this. I don't know why. I keep telling them to stand up straight. And mom, they can't. They're having a problem, and this is what it is. Actually, the scoliosis and the pectus excavatum is two of the most common uh, condition that needs to be done on a sports physical, and it will be ding 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 on this one. It will be written on the sports physical form when you check them. Check for pectus excavatum. There's two of it, pectus excavatum and pectus carinatum. Pectus carinatum is known as a pigeon chest, where your chest is out. Okay, it's outside. I call it a pigeon chest. If you have seen a bird, like when you feel it sticking out, that's a pectus carinatum. They are not worried about that. Okay, the reason why they are worried about the pectus excavatum, which is this one, it's because of the depression. Okay, there is a posterior displacement of the sternum with the pectus excavatum that can produce heart deformity. With the anterior of the on the right ventricle, they can indent that. So that's the reason this is very important. A lot of time when you do sports physical, people will come to my clinic and they act like they really know me. Some of my friends will do that. Oh, my son needs this sports physical. Can you just sign it because it's due already tomorrow? Not because I know you, I will just sign the paper. Your son had to go through this, or your daughter will have to go to my test. And if I look at them and I check them and I see abnormalities that needs to be addressed, I am not going to sign that paper. Why? Because it's your signature on that physical that you cleared them. Do you think these parents, if something happened to their kids, they will tell you, oh, it's okay. You know what? That's fine. Don't worry about it. No, it's not. They will come back to you and tell you, you did not check my son very well. You did not do your job. It comes back again. What happened? I thought we're friends. So there is no friendship when it comes to your practice. You can give them a break with the price. You can give them free samples of medications, but never ever cut down on what you need to do for their child. Even though they get mad at you. So many parents that get mad at me already because I will not sign that form until I send them to a cardiologist. Because the pectus excavatum, the depression, like I said, it has a displacement that causing for the heart to have a deformity. So if you don't send them to a cardiologist and the cardiologist give them a clearance, and you just did it, and something happened during the game. Have you guys heard of, and this is on a lot of news already, about championship on the football? Somebody will, after they win, the quarterback will just drop dead. Once they check them, oh, there's something wrong with the heart. Question, how did that quarterback was able to play to begin with if he has a heart problem? Right? So somebody put a signature on the form for them to be able to play. So, and you don't want to be in that position. Believe me, you don't want that guilt in yourself. I mean, the parents may not get back to you and sue you, but it's the guilt that something happened to that boy or to that girl because you missed something. So just explain it to them. I mean, This is one of the important thing that I always looked at. And this is one of the reason why they put it on the form to be checked, aside from the scoliosis. And even the vision also. Some people will tell you, oh, I wear my glass. I have a glasses, but I didn't bring it with me. And you check your vision at your clinic and it's 200. My God, this patient is blind. And and they're just like, the mom's like, well, she has her glasses. Go ahead and just check it. No, don't. Anything that's not complete according to what you want, do not sign your name on anything. Just piece of advice. And why do we check also thoroughly? This is a case that I have. Well, no, this is not my case. This is just a picture from the internet. Anyway, genital abnormalities, especially with the kids. Like I told you, when I check my patient, I check them thoroughly, and which is I'm glad I did. I have a parent that came to me. She wanted me to just check the daughter because she is coughing and she has cold, but she went for her physical just yesterday. And I said, oh, okay, they did not. I said, well, they didn't prescribe her anything. So I just wanted to go ahead and take a look at it. But considering that she's a new patient to my clinic, I had to do a physical again, for my clinic. So I did a physical on her and everything. And part of my physical that I checked for little girls, I mean, you just open it up. I mean their private area. You open it up just to check, make sure that it's open, okay? So when I checked it, the mom was there. The mom was looking at me so weird. And then she goes, my daughter is 9 months and nobody had checked her the way you're checking her and asking me to take off her clothes and just leaving the diaper. And I goes, what do you mean? And she's like, no, they just listen to her with her clothes on and that's it. So when I checked this patient on her private area, I kind of like already, I told the mom, like she knows already. I goes, oh, she has a fused vagina. And she's like, she has what? I goes, oh, she has a fused vagina. And I show it to her. And I goes, I would think you know this already because your doctor would already have put it on your attention. And she's like, no, I did not know that. And I don't even know. I was like, I saw that every time I wipe her, but I thought it's normal. I didn't know. I thought it will open or I don't know what's going to happen to it because this is her first child. And I said, no, that is actually a fused vagina. And they really don't know that because then she goes, but she still pee. I'm like, yes, because the ureter where the pee comes out is still there. It's open, so she pee. So for her, she pee, that's good enough for her. So when I put this on her attention, I told her that normally the treatment for this is a steroid, but I don't know the scenario of this one. So I'm going to refer you to a urologist and let them, because if this doesn't open, the kid has to undergo a surgery to open it up. But I'm sure they will do the steroid first, and then if it doesn't work, then they will. So, and this is not the only one that I have. I have two more patients, another 9-month-old that the parents doesn't know of what she has. I have to refer them again to urologists. And then another one that is a year old. Imagine this. Your doctor, when you take your kids to your doctor, you take them 3 days, 5 days when they're born. Then after that, you bring them 2 months for physical, 4 months for a physical, not just physical, for their immunization, 6 months for another physical and immunization, 9 months for physical. There are no more immunization on that one. And then 1 year old for another physical and immunization, then 15 months, 18 months, 2 years old, then every year. So having a year old that the parents doesn't even know that the kid has a fused vagina, that makes them mad, that they make them upset, that nobody had educated them, nobody had told them about this. The question is, did they check it? Did they take the time to check the patient? Did they do a thorough examination or well examination for this patient? Did you treat your patient fairly? The answer is no, no, no. And don't be that person. Don't be that provider. Be the aggressive provider that you will help. But again, educate them. Another thing that's very common that I see is this phimosis. When the baby is born and the parents choose not to circumcise their kids, I mean, I respect that. It's your thing. But again, they need to be educated that, okay, if you don't want to circumcise your kid, make sure that you pull the foreskin a little bit and clean it. Teach them that, okay? There is a phimosis or paraphimosis. Phimosis is when the foreskin on the penis doesn't go down. A paraphimosis is there's too much skin that when you roll it, keep rolling and rolling and rolling, that the penis is already getting choked. That if you don't pull it back again, that will have a gangrene because that will stop the circulation of the blood. So these are the things that I am teaching my patient. You wouldn't believe I have a 17-year-old that I did a physical. Like I told you, I checked them from head to toe and private area. And I asked him, are you circumcised? They don't even know sometimes if they're circumcised or not. And then just like, I don't know. And then I looked at it, he's not circumcised. I said, do you pull the skin to clean it up? The answer is, what? And goes, and I said, do you pull the skin? I said, no. I'm like, okay, let's just take a look at this and let me examine you. My God, it's like a cottage cheese underneath that foreskin. And he is twitching with pain because it's painful. It's the first time for 17 years that you pull that foreskin. And he was so mad. I'm just like, oh my God, you need to go to the restroom and clean that out. And he was there I'm just like, I went inside the restroom with my assistant because he's been there like 10 minutes. He's not coming out. And I'm just like, I went inside and I goes with the mom also. I goes, what's going on? I was like, it's just so painful. I'm having a hard time cleaning it. And he got mad at his mom. And he told his mom, why didn't you do this? Why didn't you tell me that I have to do this? And the mom felt so bad. And I felt so bad for the mom because you know what the mom said? Nobody had told me to do that. I didn't know I have to do that. And so with my patient, I make sure that they do, that I teach them little things because little things will go a long way. On the next slide, you will, question time.
Hey, Jackie,
Yes.
generally during the first, you've already been talking for an hour and 20 minutes, and this is
Yes.
a wonderful discussion. I wish you could see all the compliments you're getting.
Oh, thanks.
I mean, one of the compliments that was just made was that this type of health education should be more prevalent in schools early on. No kidding. But one thing I wanted to say to you is that generally we see about 20 to 30% of the people drop off during the first hour. Virtually no one has left your discussion. People love what they're hearing. And so we've got a bunch of questions. Taylor, you want to take it away?
Yes, of course. Okay, so we have some of the first comments that somebody made was that they knew about your clinic and they were excited to actually hear from you because they live in the community. So that's exciting. And then
Nice.
Someone says that you're very inspirational and passionate and kind. And so we just want to share that first. But so what is the most common condition that you treat in both like kids and adults or separately? Is it scoliosis or is it something different?
Okay, the most common thing in our clinic that I treat is coughing, congestion, allergies, sinus infections. when it comes to the scoliosis, is I am just the way to tell you that you have scoliosis. Scoliosis is if there is a measurement, there's a degree. Okay, if it is like 20 something degrees and more, we have to refer you to. I refer them to Scottish Rite, and they will evaluate you, and they will put you on a brace that you will wear. That's why it's very important at the young age that for your kids to be able to get diagnosed with this, because they might still be able to correct them in a different way, like putting a brace that they will have to wear, I believe, like all day, or even only take it off during the sleep, something like that. But these are the things that needed to be addressed at the young age.
Gotcha.
Yes.
And so with adults, it's mostly coughing and stuff as well.
Yes, for the adults, coughing, I mean, right now, especially at this season, but really the one that I've been seeing with the adults are, maintenance for the blood pressure, diabetes, cholesterol. And like I said, I offered that $99 special. It's because I want everybody to have a basic of what they have. And because nobody knows, when somebody comes to me and is like, well, have you been diagnosed with cholesterol? No, I have not had any physical exam. So this is a good basic for $99. You'll know what's your standing. If you find out that you have high cholesterol, then we'll educate you and help you to be able to mold you and help you to be healthy, to be better. And then for if it's beyond to what I can do, I refer them. Like I told you, we have a scope of practice that I can only do. So if that's something beyond my scope, I don't touch it.
So are there like specific medications that you can and can't prescribe? So like what does the range consist of? How do you know?
Okay, as a nurse practitioner, one thing we cannot prescribe are narcotics, which is I'm thankful for, because I don't like prescribing those kind of medication unless they need it. But there are other things that can be done. But I can pretty much prescribe a lot. I mean, most of the medication except narcotics.
Gotcha. And then somebody was asking, so do you guys treat like mental health at your clinic? Because they weren't sure if at a lot of clinics, if they treat that, you think you might have to go to a psychiatrist. So that
Okay.
was the question that we got.
Yeah, on mental health, which is I feel bad right now because I know I've been seeing a lot of teenagers actually. I tell them that if they feel that they needed to talk, because sometimes they just need somebody to talk to aside from their parents. As long as they are not suicidal, as long as they are not homicidal, I'll be able to see them at my clinic, just prescribe them something for anxiety. But again, if they are beyond that, then I refer them out.
Gotcha. Okay. And then, so you also do vaccines at your clinic as well. Is that
Yes.
probably the most popular thing you're doing right now?
Yes, actually, we have the COVID vaccine. We have a Pfizer in my clinic right now, and which we've been doing, and it's free. So
That's awesome.
yeah.
And so if someone were to come in your clinic that you can't necessarily treat, or like you told me the other day, you had somebody with a cut and then you found out that they needed to go somewhere else after you'd kind of started helping them or looked at the injury, how do you go about that? And do they pay still, or do they leave, or how does that work?
Well, here, okay, that one. I mean, you will see the picture of that. I will talk to about later.
Oh, okay.
I have this patient that came to me, and he has a cut right here. And I said, "How did you get the cut?" I hit a metal, like I guess he hit it so hard that it put a cut on it. And I love doing stitches. I love procedure, And if I did not take the time of examining this patient, I probably would have caused more problem to him than anything else. Why? Because when I was checking this patient, before I check, I mean, okay, it's a suture, have the tray ready. We'll do some suturing in there. I test them. I check them, and I goes, okay, can you move your finger? And he goes, yes. And he moved his finger, and as you can see, he only moved this. And he goes, move the middle one where the cut is. And he's like, I can't. I have to do this, to be able to move it? And he goes, maybe it's just hurting me, maybe because of the impact. And I'm like, I don't think, I'm in my mind, I'm like, I don't think so. I think there's something more than this. So I looked at it, I keep clean because it keeps bleeding and bleeding, and I keep rinsing it. And then I finally saw something that had caused that problem for it not to move. It's his tendon. It was cut. So the impact of that hit that he did on the metal affected the flexor of his tendon. So with that, I told him, you have to go to the emergency. And I examined him and I checked him, and it depending on the case. I don't charge my patient, even though I already see them, but I have to send them to the ER. They have to pay more money going to the ER. So I just tell them, you know what, just don't forget about the consult. Just go. You need to get that taken care of right away. So, things like that.
Nice. And then another question that we had, it's kind of off topic, but what made you want to, obviously you were a dental assistant when you came here because you couldn't get experience to be a dentist at first, but why did you go from a dental assistant to real estate? And then what made you come back and do something different?
Okay. I became a real estate is because I was talking to a friend who's a realtor, and it seems like he's making so much money and having a good time with his life and he's not in the office. He's like outside. He's just home. So after the dental assistants, actually, I'm a realtor and a dental assistant at the same time. Because you can do that. I can show houses on the weekend, and I work Monday to Friday at the dentist, So, but then when I started getting busy, that I'm getting phone calls, we want to see this property, we want you to be our agent. Then I dropped being a dental assistant and became just a realtor, which is work for me because with the new baby on the way and all that, it works better for me to be able to take care of her. And then when my husband comes home at night, he takes care of her, then I show property, or sometimes I take both of them. It's just like stay in the car.
Hey, Jackie, do you
Yes.
think that your career in working with real estate and as a real estate broker has made you a smarter investor yourself now a few years later? And I ask that because I remember an old joke that says, if you want to find a bad investor, follow a series of doctors around. So do you think your life's experience has made you a smarter financial person?
I think so too. It kind of like, but no, the truth is you still don't learn from it though. I mean, every day is you're learning every day. There's always an experience. And I will be talking about that. You might think, right? A better investors, a better when I decided to be an NP, and I will talk about that when I open this practice. And but no, I mean, having so much of the career being a real estate, yes, it helps a lot.
Awesome. Okay, well, I think that's all the questions that we're going to ask for now, since
Okay.
you've got a few more slides to hit.
Okay. So these are some of my favorite cases. Wow. Okay. Right there. So this patient is a diabetic patient. He's a non-compliant with his medication. And I told him, if you don't, this is what's going to happen to you. He is lucky that this toe right here still has not gotten amputated, because that is one thing that's gonna happen if you don't take care of it. This patient doesn't have any insurance, and I gave him a set price. Okay, for this one, for the wound care, all this and that, that's it. That's the price. I didn't realize that I'm going to be seeing this patient for more than a month. It's just like every day, every 3 days he comes back, and I keep on treating it, packing it, and all that. And this is one of the last one that I have seen, and he was so happy. The wife is so happy about it, and they're so happy that they send their whole family member to my clinic. And I've been seeing their grandkids, their kids, and them. So it pays off. I mean, like what I said, it's not always the money at hand. It's what's gonna take you to the future. Yeah,
Hey,
I could
Ja-
be, yes.
Jackie, one of the students said, "Wow, I sure hope that the patient became compliant with his diabetes after." And, certainly in the emergency room, we see
Mhm.
all these things. They get the big toe amputated,
Yes.
then they get a mid tarsal, which is midfoot amputation. Then they get a below the knee amputation.
Yes.
And so sadly and unfortunately, so many people are not able to gain the compliance or unwilling to make the sacrifice to gain the compliance.
Well, the only thing about when you talk to a patient and they're non-compliant, it's not because they don't want to be. It's because they don't have the funds. They don't have the money. And that's the reason why you educate them. Um, they go to a different doctor that prescribe them a very expensive diabetes medicine, where in fact you can have a medicine that will do the same work for a less amount of money. So their mentality is, no, I only have to take this medicine because this is what my first doctor gave me, but I can't afford it. So for them, they rather not take the medicine because they're not taking the one that's prescribed for them. So again, this is where education and taking the time to explain to them that that will help them. And actually this patient became compliant because I told him, one more mistake on this one, you might lose this toe or even more, or even your foot. And he got scared. So he's compliant. This one is I felt bad for this lady. She is abused. That's actually it's a battle of the her husband is having an her husband is having an affair, and the girl has the nerve to go to her house and get mad at her, and she cut her with a bottle of like that. She hit the she it's a broken bottle and she hit it with it. That's the reason why she got this cut on her chest, which is, I'm glad it's not as deep. And again, this patient doesn't have any insurance. Um, and she was just really, she's scared, she's afraid, she cannot even go to the police to report what happened to her. She doesn't even want to go to the ER because they're going to question what happened. And I was able to treat her. I put 18 stitches on her on this one. And this is the before, and this is after few days after I had taken out that the suture. This is another patient that I have. He was just lifting something, and when he lift up, there's some metal that's sticking and cut him on the wrist area, and I just put a suture on it. Sometimes the best thing you can do is not think, not wonder, not imagine, not obsess. Just breathe and have faith that everything will work out for the best. And with me, that's what I do in my work. I don't overthink, because I kind of know what I want, and I know what the purpose, what's my purpose, that God had put me in that position, in that place. So just for me, I just have faith in everything that I do, and then you just hope and pray that it will work out for the best. And this is another one. This guy has a little store and he cut himself with a knife. I mean, I just want to took the picture sideways so you can see a little Pac-Man right there. Hurt his thumb, and I suture it. And after suture, 10 days after this is the suture removal. Ability is what you're capable of doing. Motivation determines what you do. Attitude determines how well you do it. I have this quote in my office because I want my staff and myself to be reminded what we do here, what we see, what we care for is what motivates us to do what we are doing. And the attitude that we have will help us be able to do a good job, to be able to have that, be able, the capability to do the right thing. So it's supposed to be attitude with the motivation and the ability to be able to do the right thing. And they all go together. This kid, like I told you, my clinic is a family clinic. So I see from baby to adults. This is a 2-month-old girl with severe eczema, as you can see on her face, and the parents are just really worried about it. And the good thing about having networking, with other specialists, this patient, the mom, they don't have insurance, and with this kind of skin, the first thing you do is like, you know what, they need to see a dermatologist. But with the dermatologist, it's gonna cost them more money just consulting with them, right? So what I did is I took a picture of this and I texted to the dermatologist that I know, and I told him, I said, look at this skin of this baby. And he told me what to do. I said, okay, this is what you're gonna do. Prescribe him this medication twice a day for 2 weeks. If it doesn't get any better, I'll tell them to come in my clinic and I'll work with them. So again, what we do to our clinic, it's not just, helping our patients, but making them feel better and reaching out to other doctor, to other specialists that might be able to do the same thing for them. So I prescribe for this one, if you have anybody, Dermasmooth. Dermasmooth is one of the good for derma that will help for the skin. It's a good one. And I'll be honest with you, dermatology is always the challenge for me also. Sometimes they are rushed that you think this is what it is and it's not. It's a, I guess it's that's why they call it practice medicine, right? We're just practicing and see which one will be good. So, but so far on her, it did well. It helped, so they don't need to see the dermatologist. And here's another patient that I have. This patient had this wound for 2 weeks. He's a truck driver and he sits all the time. And he get to the point where he's having a hard time walking already, that he has to ask permission from his boss, and his boss is just like, what's going on? He has to pull his pants down to his boss for him to just allow, oh yeah, you go. They just don't take their words. That's why sometimes the patient is not just because they're non-compliant, it's just because they really don't have the means to do it. For them, working, they have to work to earn a living. I mean, if they need to see a doctor, they need to have income to pay. And that's why it's good, always good to do some good deeds, some privy, some pro bono to your patient. Sometimes life is not measured by the breath we take, but the moment that take our breath away. And every day when a patient comes back, they come to you, they have a 94% saturation. They're not really catching up the breath. You treat them, you feel them, let them feel better. It's what takes my breath away when they tell you, they come back, say, I feel better, I feel good, thank you. And they appreciate you, and that's what it is. And I think that's what's important with especially for the medicine or for what we do. That's what matters. It's how you affect the patients, how you affect your client, or I mean, that's what matters. And here's another one that I did. Got his finger right here, suture, and another one. I have other things that I do, like ingrown tail removal, but I mean for some reason I don't take a picture of that. I don't know why, but anyway, um, I have other things that I have done, but the scope of practice as a nurse practitioner is primary health promotion. And I've been talking about that. Disease prevention, like, the uh, high blood pressure, cholesterol, assessment, diagnosis, management of common illness, and expanded roles for specialty care. With that, like I said, with something like that, maybe you can refer them if that's something that's beyond your the scope of your practice. But in anything that you do, like with me, it's not just me. There are other people that are involved with my practice, like imaging places. If I need to send my patient for imaging, they're there. For other doctors, for GI specialists, for optometrists, simple as having their vision checked. You work together, and you cannot do everything on your own. I don't specialize on GI. No, that's not my forte. That's not my job. You go somewhere else. If it's beyond to what I can do, I ask them. And this is the one that I was telling you about. The picture is not really good, but you see right there, that is the flexor digitorum superficialis that was broken in this patient when I'm trying to lift, and when I'm trying to told him before I do the suturing, wiggle your finger, and he cannot move the middle finger, that he has to do this, for it. I right then, that there is something wrong. So before you do any procedure at all, again, thorough examination and examination will help you do a good job and decide what you need to do for the patient. All right, here comes with the when I opened my practice. First of all, why did I open actually, I already told you about that. Why I opened a family practice. It's because I want to be able to help not just pediatrics, not just adult, but the whole family. So it's kind of like one stop shop, one stop shop. That it's already there at the clinic. When I decided to open my clinic, I just woke up one day. I was driving to my work that I started not liking anymore, and I said, why don't we just open your own clinic? And I'm like, yeah, that's a good idea. I'm talking to as a third person. But anyway, so when I decided to do that, and you hear this on the commercial, small business will loan you the money, will learn, and I'm like, oh, I spoke with my husband and I said, why don't I just open my own clinic? And he thinks that it's a good idea. And he said, well, what are you going to do? I said, well, let me look around. Let me see what needs to be done to be able to do this. So I look into it. I spoke with an accountant. I spoke with a lawyer because they have to draw all the paperwork from start to finish, finding a name, finding a location. I found out that you cannot open an account if you don't have an address. You have to have an address. Because everything, and even with the name, you have to have a name already. You have to register with the state. You have to all that. So I got it all done. Would you believe I got it all done in less than a week? I found the name because I already have a name in my mind what I want. So Clinica Familiar, your family clinic. I said that sounds really good. And the lady that was working with me, the tall lady in the first few slides, she's the one, Jackie, when you open your clinic, I want to be with you. I want to go with you. I said, okay, good. I have my medical assistant now. So I got the place. I called up the thing, and then I said, you know what? They told me that it will take, and you have to read, you have to know all the details before when you sign a lease, you negotiate. And I told him, I said, by the time I get this place running and all that, it will take me at least 3 months to get everything. And I've been told that for me to get approved on some of the insurances, it will take 3 months from credentialing to applications and all that. So I negotiate with him because I have to use the address, right? I have to negotiate with him, no rent, no payment, no rent for 3 months. Actually, I'm trying to push for 6 months, but he said, no, 3 months. So I did that. So I was in that clinic for 3 months working just the paperwork. And so we have the place, we have this, I signed the contract because you have to have a place, remember, before you can even open a bank account. So I went to this bank account, to this bank that was uh, referred to me. It's actually it's an international bank, and I went there and I said, "Well, I'm wanting to apply for a loan." Well, do you have a business account? No. Well, you need first of all you need to open a business account, and after you open a business account, and then we'll look at it, and then you will be able to get a loan. All right, great. So how much do I need to open the account? Just like, okay, this is the amount. I wrote the check, I opened the account, put the address, everything. Okay, so I have the checking, I have everything. Now, let's fill up a loan application. I fill up the loan application. So this and that, the address. Great. Rejected. Why am I being rejected? And then it goes, well, do you have a 2-year business tax information? What word new, starting, you did not understand from that application form? Starting a new business. Oh, we cannot lend you the money because you have to have 2 years filing tax. Are you kidding me? I was so devastated. I went to a different bank, same thing, same requirements that they asked. And then I told them, why did you ask me to open a bank account, a business account, if you're not even going to lend me the money? Well, because you need to have a business account to open a loan. But you're not loaning me the money. I was like over and over, like going back and forth. So I told my husband about it. I said, I think I'm just gonna forget about this. I don't think we can make this. Nobody will lend me the loan. We can't do this. I'm so glad I was married to a very nice man that supported me with whatever I decided. He pulled out his 401k for me to be able to get started. I maxed out our personal credit card. I apply for a personal loan. Everything is personal for me to do this. Luckily, it's just me and my one MA that's in the clinic, and I don't have to pay the rent for 3 months. So really, I am the last person to get paid. I didn't even get paid for a year. I did not pay myself because I rather save the money, try to pay my MA, pay the bills, pay the equipment, everything. And would you believe all my equipment is not brand new? If you know about OfferUp, it's a garage sale app. And all my examination, the bed that I have are all from there. I did not bring any brand new things. I don't need a brand new. And then you have to be, you have to look around. There's one clinic, a pediatric clinic that is closing that I went into, and I spoke with the doctor and I said, so when are you moving? And it's like, tomorrow I need to close. And he has still so many stuff in that office. And he goes, make me an offer for this, for this, for this. So pretty much I got everything that I needed for my clinic from his clinic. So again, it's not a brand new one, but hey, you use it. It's usable, So my husband and I, we are really paycheck to paycheck for a while, right there. I mean, for months. And because no bank will approve. And then 3 years to my practice, I was able to pay off all our credit cards, pay off that personal loan that I did. And we still continue to contribute to the 401k and have savings. It's not easy, but if you have the right people that's supporting you, if you have the passion of what you want, it will come together. I mean, actually, that MA that I have, she even told me. She goes, Jackie, you know what? Don't worry about paying me. And I'm like, no, I have to pay you. You have a rent, you have this and that. I have to pay you. But I mean, it feels good that even her herself is willing, is willing to do, to give it up just to help me out, to reach out, because she knows my vision, she knows my motto, she knows my goal for opening that clinic. And in opening a clinic, you have to have a marketing strategy. So this all includes that. But would you believe I don't have a website for my clinic? I have Facebook, which a lot of people are using. And the way I did my marketing is I personally walk around the neighborhood with a flyer at lunchtime. I took my staff with me. You go there, I go here, you go there, and door to door, putting that flyer out, talking to people. I'm at the store. I will have my card with me. Hey, they just opened a new clinic here. I'm not introducing it's me. I'm just telling them there's a new clinic down there, and that's the marketing. It's the people. You just talk to them. And another thing too is, as you notice, the name of my clinic, Su Clinica Familiar. It's because that community in that Garland area is mostly Hispanic community. So they feel at home when they see the name, when they're like, oh yeah, this clinic will take care of us. It's part of us, and which I am. We are part of them. We are part of that community. So that is the marketing strategy. And I can talk more about what other things, but one thing I have learned, you learn from me, because there's this lady that came to my clinic and says that marketing, you put your name on the Kroger card, so when the people put their purse and this and that, your name is there. So I did that. That's the most expensive grocery cart I bought, because it didn't bring me anything. It didn't bring me one patient at all. And now I believe with the word of mouth, you treat your patient right, you educate them, you treat them well, guess what? They are your marketers. They are your people that they will spread the word for you. And like I said, I don't speak Spanish. So um, there is this book or Google, but I have my own little notebook, my cheat sheet that I have in my pocket. And aside from my staff that's helping me translate, you have to learn also even the basic. What is the Spanish of the basic, so at least you can communicate with your patient. I have a funny story about this. I have a patient, and she's having a hard time breathing, and she just speaks Spanish, and all my staff is so busy. So I kind of just opened the door, and I goes, "Hey, how do you say it? You need to use the neb machine so she can breathe." And so they said it to me by the hallway what to say. And as they saying it, I was saying it to the patient as I hear them. And the patient's face just lit up. And then she pointed on her breast and she goes, "Yes, mi gusto." And I'm like, and my staff just laughed. And I'm like, "What did I just say?" I said, "You just asked her if she wants a breast sleeve." I'm like, oh my God. I'm just like, has nothing to do with the breathing. But sometimes you have to be careful the way you say the terms, the words. So it's very important. If you don't know how to say it, don't say it. And like I said, I mean, this is a virtual learning, but I used to have a lot of students from the UT Arlington that they do their clinicals at my clinic. They have 180 hours, 80 hours, 240 hours. And I let them come to my clinic. And I've been doing so many students from the University of Arlington that the University of Arlington had given me a title of adjunct clinical instructor. Of course, it's a non-paying job, but it's nice to have the title. And for me, it's really more of like teaching the future nurse practitioner the way I want other patients to be treated. And nurse
Well,
practitioner.
hey, Jackie, somebody asked a note a few minutes ago. Wrote in the chat. I'm on the admissions committee at UT Southwestern, and they said, how would we consider hours shadowing with a nursing practitioner for an application to medical school? And I say, firstly, those hours would be fine. And secondly, with someone like you, I think it would be fabulous. But because I want physician candidates to see the kind of love and enthusiasm that you have for people that you take care of.
I mean, I don't mind. I mean, the only thing there is like I said, I'm just a nurse practitioner. I'm not a doctor. But one thing that I can tell you is the care that I give my patient. I don't think any doctor can compare to that, because I'm not putting the doctor down, nothing. But the way I talk to you guys about the passion that you see in me is the way I talk to my student. And when I teach my student, I don't just spoon fed them. When they ask me questions, I ask them the same question. So they will search and come back to me with an answer. And then I'll tell them, yes, that's the answer, or no, that's not the answer. So, it's not just for, I don't like my patient I don't like the student just coming into my clinic, just like following me around, or, oh, I just need my hours. No, I want you to be involved. I want you to be hands-on, so.
Jackie, while you were talking, several notes popped into chat that said, I'll read one of them. There's no just in the fabulousness as an NP. And then Lena said, you're not just a nursing practitioner. You are an amazing and passionate practitioner. So thank you so much for the way you put it.
Thank you so much. And what you see is what you get from me, and that's what it is. This is no facade. There is not, because I'm talking to you, and then it's not. You can come to my clinic and you can see it. So I mean, nurse practitioner had gone up, increasing in numbers. Unfortunately, you will see, and this is what I want to emphasize. If there is a nurse practitioner student right now, please, and I hear this and I see this on the group chat, because we have a nurse practitioner physician assistant group chat on the Facebook. And some of them will say, oh, I'm a new grad. I have an interview tomorrow. How much should I ask? Or how much should I be making? Or how much? Please. Like I said, money is important. People keep saying, but I've been a nurse for 20, 25 years, even 30 years. And how long have you been a nurse practitioner? 1 month, 2 months? And you want a salary of a 20, 30 nurse practitioner in practice? You cannot compare that. You cannot compare your job as a nurse to a nurse practitioner. That's the reason why a nurse practitioner can open up their own clinic, can write their own prescription, can see their patient. Why? Because there's a liability that comes along with it. Now, and I tell that to all my students that are that shadowed me, that came to my clinic, because one of that student, actually, I saw her comment on the Facebook. I'm like, I can't believe she is asking this question. She is asking how much he should ask for for this. And I said, and I talked to her and I said, the best question that you will ask when you are interviewing to be included in their practice is this. First, what is it that you can teach me so I can be a better nurse practitioner? Second, will you be available if I have questions? Third, will you be able to pay for my continuing education? It's not how much you're going to be making, how much. It's not. It will follow. You apply for a job to this clinic. They trained you well. You are good. You want to move to a different clinic? Hey, move to a different clinic. What can you ask now? A better salary. But for beginners, it doesn't matter that you have 30, 40 years nurse experience cannot compare being a nurse practitioner. If you're a new grad, you are still a new nurse practitioner. Please, I don't mean to to cross any path in here, whoever is listening, but that's just a piece of advice. When you look for a job as a nurse practitioner, as a new grad, see, because the truth is, if you join a new practice, you are a liability to their practice. You are a liability to the doctor that will handle your license. If you do something wrong, it's you and your supervising doctor. So what happened to many years of practice if on your first 6 months you already made a mistake because you are more concerned about how much I want to make more money. Yes, it will come later on, but be patient. Be patient, and it will come to you. So that's just something, because I was talking to a friend last night, and that's what he was telling me, that he noticed also on that site, that they're just asking and they're losing sight that they didn't realize that new grads is a liability, a great liability to a practicing clinic. So in my office, this is our schedule. We take both appointments and walk-ins. I believe that when the patient needs to see a doctor or a provider, they need to be seen right away. You don't call and say, oh, my son has a fever. Oh, we don't have an opening, but we can see you next Tuesday. What will happen to the fever? So I believe, and my walk-in is not like in the after, I'm sorry. My walk-in is not just on a certain time of the day. My walk-in is all day long. My appointments is whenever they set up an appointment. But that's what it is. And then I open a Saturday. If there is, I try to be off at least one Saturday a month, to give my staff a break, and also for me, for my family. And we take pretty much all insurance. Right now, I'm on Blue Cross, but it's like I'm trying to reach somebody. I can take Blue Cross, but they said I'm like not within the patient can use it as their deductibles or something. But pretty much we check everything. But really, the most one that in my practice is the Medicaid. Because I think because of the neighborhood, because of the location. So what is a nurse practitioner? And nurse practitioner, as you can see, is an advanced degree in assessment, diagnosis, and treatments of patients. And you have to pass a board, a national board. And on mine, there's a lot of nurse practitioners that you can go to. You can go for family, which I am, because I like the combinations of seeing different, ages, and then different kind of sickness and illnesses and able procedure, and that I can perform. But there's also pediatrics, women's health, psych. There's a lot. Adult. There's actually an adult and geriatrics nurse practitioner actually too. Again, I think there's more than 234,000 now. Nurse practitioner. Like I said, it's continue growing. Again, with this, we specializes, again, as you can see here, preventive care and teaching patients about their condition, how to stay healthy. Please don't just be the kind of provider that will just give them medicine to shut them up. Don't do that. Don't be that kind of practitioner. And again, it's just like what's on the other one. This is what we can do for you as a nurse practitioner. They call us as a mini doctor, but like I said, I still will not address myself as a doctor. I am proud to say I am a nurse practitioner. I am not a doctor, and happy to be that way. And yes, we can prescribe. You still have here in Texas, you have to have that authority, the prescriptive authority, to be able to write a prescription. And as a nurse practitioner, we cannot write narcotics. Why do you choose a nurse practitioner compared to who? I don't want to toot my horn, but I guess, like what I said, as a nurse practitioner, we spend more time with our patients. I guess we got used to that being a nurse. You sit down there, you talk to your patient, you know all about them. You spend more time with them than the doctor spend time with them. So we listen to your worries, to your concern. It's not just the illness or what your problem that you come to the office. And sometimes patients will tell me already the whole story about their family, and sometimes it helps them. It's kind of like they're using you as they're venting. And sometimes my staff will joke around with me and said, so you're a counselor now, or you're a psychologist now? I'm just like, I don't know. But it's part of it's part of our job. It's part of nursing and caring for people. I myself can stop that. I will just continue to sit down and listen to them. And so don't just go through the motion, give 100%. Like I said, even you're at your practice, you're at the clinic, be 100% there, because your patient wants you to be, and it's fair for them. And when you're with your family, give 100% with your family, because your family deserve that also. Again, this is my clinic, and actually my goals, my dream is to have another location, which I'm already talking and looking into. So we'll see. And another thing that I like is don't give up. We have all gone home in tears. We've all second guesses why we do what we do. We all felt like failure at times. We all have wanted to quit at some point. Just remember, you save lives, you comfort the sick, and you cannot expect that to be easy. And there's none. It's not an easy. There's no easy job. And with all this, because of what I do, it's not me. It's not my family. And with this, I get my strength, my refuge, and I give thanks to the Lord. And I'm a Christian, and that's and for me, that I owe it all to him to be successful. That's it. Thank you.
Jackie, I think every day that we don't praise God for all the blessings that flow, whatever one's own belief structure may be, this universe is so huge that we are so tiny in comparison to the majesty of this universe, and that is the truth.
Yes.
So just thank you for those blessings, and bless you for your discussion. Nicole just said in chat, you're such an amazing speaker and so inspirational. Thank you so very much.
Thank you.
You've actually answered along the way a lot of questions.
Okay.
And I really just want to tell you how remarkable it was. I went through my own experience of setting up my own urgent care center in 1982. That was the first $500,000 I ever borrowed. And like you said, you end up paying everybody else first before you pay yourself. And I know that feeling very, very well, because I went through it. We didn't make any money at all for years. And then finally, over the years, the clinic began to make some money. And but it took a lot of personal time, dedication, hiring staff, training staff, and just always trying to be better. And like you said, I don't recall that I bought any equipment new. I went through that. I know exactly what you mean.
Yeah.
One gratifying thing about your own practice is that you do make your own decisions. You decide who to hire, occasionally fire.
Mm-hmm.
And, if I needed a machine to do a complete blood count, CBC, I would do it over coffee in the morning. That was my decision to borrow that $15,000 and, put it on a note I was going to pay off on 3 years. You've been through all that. So just thank you for that remarkable discussion about going out on your own. We've taken over 2 hours of your time. We still have over 200 students with us. I think that the thing I hope everybody heard tonight from Jackie is that to do what she does and the way she does it requires a commitment to continued ongoing study. You have to be prepared on the front end and continue to study on the back end. And especially when she showed that photograph that she sent of that baby's face to a dermatologist, what Jackie was doing is she says, I'm going to find the answer to this problem, and I'm going to keep asking people that I know until I can find the answer. And that is the kind of commitment that you have to have as a physician. One last comment, Jackie, if you'll just forgive one more comment, is
yes, that's fine.
I work around hundreds of physicians. We have 66 residents alone. We have 120 faculty. And I work around folks all the time. And I will tell you that in the big, busy world of medicine, where we have to really move from patient to patient, that finding the time to really, really find out what's on the patient's mind and to take the time to examine the patient, get them into a damn gown and really examine them. Don't try to do an abdominal exam with the patient still wearing their blue jeans and their belt. But hold yourself to a high standard of both clinical care and clinical accuracy, as well as a humanitarian approach to getting the answer to what the patient really needs. And so, Jackie, what a tremendous presentation that you made tonight. Taylor, I think, Jackie, I think we have a next slide because we're going to give an exam over your talk. Can you go to the next slide? Yes. So Taylor, you want to explain to everybody what this is?
I guess, so every week we do a quiz based off the session. It's just kind of like just to make sure you're paying attention. So it'll be open until right before the next session next week. So if you want to get out your phones and scan the QR code, you'll be able to get the link to take the quiz. So I guess that's it, right?
And the QR code will also be in the slides that are on the recording that's placed on the website. So you'll be able to get that. So let's see. Karen said, Maraming Salamat Po, Jackie. And you're my honorary Tita. I don't know what that means, but what does that mean?
Thank you so much, Tita. You are, well, Tita is aunt. So I guess she's Filipino. It's maraming salamat. Thank you very much.
Well, you're now officially a little sister of virtual shadowing, and we are so deeply grateful. Jackie, typically we have about 5,000 people that will see the recordings.
Okay.
Each of them will become a medical professional and see 100,000 patients in their lifetime. 5,000 times 100,000 is 500 million.
Yeah.
Jackie, you've touched 500 million lives tonight just through this hour to a couple of hours of just presenting this charming humanitarian approach to being dedicated to humanity. So we just want to thank you so much. Everybody put a thank you, Jackie, in the chat one more time. And Jackie, be sure and look at the chat right in front of you and see all those thank yous popping in there right in front of you. I hope you can see that. So, all right, everybody. Well, is that the last slide, I guess? Okay, Taylor, thank you. So we'll be back next week with another presentation for you. We're deeply honored to have you here. Thanks to the virtual shadowing team. We've got a couple going off to medical school soon. So wish Rachel and Reagan good luck with medical school. And we will be here for you if you keep coming back. So on behalf of the whole virtual shadowing team, our wonderful speaker tonight, we just want to say thank you.